Hello, 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 everyone. It is Thursday and it is time for another Ask Christian session. Today, I am so excited because we have another special guest. But before we get into that, let's do a quick recap of last week. And also, if you're new, my name is Christian Shields. I am the founder and creator of My Secrets Purpose Conference. I also do these conversations to connect with you, to get you speaking and talking about the things that you don't really like talking about. So, those secret things that you deal with, whether it's your health, your faith, your overall relationships, sometimes we hit on that. But I want us to talk about it and let's make those things normal. Let's become more aware of who we are so that we can make the change that we want to make in our lives and bring others with us. Last week, we had a great conversation about mental health, especially associated with trauma. Trauma is something that impacts everyone's life. So if you didn't get a chance to check that episode out, go ahead and check it out on the timeline. It is definitely a must watch, especially if you have loved ones and yourself are going through some things. There were some helpful tips. But today I'm excited to share with you all a very special guest. Her name is Miss Tisha Henderson. She is a registered nurse clinician. She is a frontline employee who partners with her clients to support them in attaining the best clinical outcomes with their health. Her areas of specialty are lifestyle and disease management, and she is definitely an advocate, y'all, for health and wellness and is able to support her clients in taking the steps that they need to optimize their health, whether that's an area of exercise, whether it's stress management, weight management, tobacco cessation, healthy eating. Like she's going to give you all a rundown today. And I'm really hoping that you all could take this time to kind of drive her tips and the resources that she provides to you today into your life so that you can make the lifestyle changes that you strongly desire to make. So you all help me welcome Miss Tisha right now.
Hello,
Hello.
everyone. I'm excited to be here today. Thank you for having me, Christian. It's an honor to be here and to be able to speak with you today on this platform. So I do appreciate that.
Yes, I
Thank
do
you.
appreciate you as well. I share that this is definitely a conversation that needs to happen. It's a conversation that we all need to talk about. Our health is impacted in multiple ways. And so before we get into like the nitty gritty of things, I want you to kind of just take a minute and kind of, just bring us to speed into where you are right now and the work that you do.
Yes, absolutely. So I'm Tisha Henderson. I am a registered nurse clinical health coach. I work for a company called ShareCare. I've been with this company for 13 years. It was formerly known as Healthways and was founded by Jeff Arnold, who founded WebMD. He came together with Dr. Oz. A lot of you guys are probably familiar with Dr. Oz in 2010, and they formed a digital health and wellness platform. It uses a lot of evidence-based programs, and I like to consider the health coaches like the personal touch. So we're registered nurses, health coaches, we have registered dietitians on our team, and it is telephonic based as far as my outreach to the patient, but I do a lot of coaching in terms of behavioral change, in terms of self-care and healthcare, helping someone to optimize their health and prevent complications with their health long term. And we work in two different components. So there is like the lifestyle management program that focuses on someone, an individual that's fairly healthy, but they want to prevent complications with their health in the future. So we focus with them a lot on just like, exercise, stress management, weight management, those types of things. And then there's the clinical component, which I tend to do a lot more of. And that's where I focus with individuals on managing chronic health conditions like diabetes, heart disease, heart failure, asthma, COPD. And I just help them to really work on strategy to prevent complications long term with their health. And that, just helping them realize they're not defined by their condition and there's still a lot that they can do to prevent complications in the future. And so that's what I do day in and day out. ShareCare's vision really aligns with my life's purpose. So I feel like I am doing what I love to do. I'm very passionate about it. And I feel like that change begins with me. So that's what's kept me here because I'm doing something that I love to do. And then also I'm internalizing that change so that I'm relatable, and I'm able to really support
Yeah.
those members in taking the steps they need to take to make those changes.
Absolutely. And I want to thank you for this work because this work is not easy to do. Like your work is not easy to do at all. Because not. I mean, like when you hear people talk about like what they are experiencing, a lot of times it's hard for them to talk about it. And so allowing someone to come into your world and teach you new things and teach you about lifestyle can be difficult sometimes, because we've lived a certain way,
Mm-hmm.
right? And we love the way we live. And so with that being said, I kind of,
That's
you
right.
talked about some of the common diseases and illnesses. So, can you list like what are the top two, especially that you see amongst our community, that you are having to like battle with the most in trying to get people to, make those lifestyle changes?
Yeah, absolutely. So coronary artery disease or cardiovascular disease, heart disease, however you want to term it, is
Mm,
still the number one killer in the United States of America. Also, it disproportionately affects women. Like 1 in 5 women, I think in 2017, over 300,000 women died at the hands of heart disease. And then also you have twin epidemics, obesity and diabetes. I like to call them the twin epidemics because they're happening simultaneously. So as you see an increase in obesity, you see an increase in type 2 diabetes.
mm,
Those two alone are risk factors for coronary artery disease. So once again, it takes us back to heart disease. A lot of chronic health conditions, though, are largely preventable. And that's kind of where my passion lies. And a lot of it is linked to prolonged exposure to chronic stress. And if we can do something within ourselves to decrease our stress levels, we can really cut down on the inflammation within our bodies, and we can cut down on chronic illness. So you have wellness, then you have chronic inflammation and chronic stress, which then equals chronic illness. But a lot of these conditions like heart disease and diabetes, cancers, arthritis, autoimmune diseases, they're largely preventable. And I'll talk a little bit more about some study and research that has been done around genetics and how genetics plays a role, but it only plays about 20% of that
mm,
role. 80% of it is predicted to be our lifestyles and our environment. So your genetics are not necessarily your fate. And we have the power within us to turn certain genes off and on. So
mm.
meaning you may be more predisposed to diabetes, for example, because you have a family history of that, or you're, genetically predisposed to that. Lifestyle changes that you make, the environment that you live in, how you manage your stress, how you feel about yourself, the relationships that you're in, the career fulfillment that you have the control or the ability to really turn those genes off. So then that disease process that condition is not expressed, even though you're more predisposed. And that gets into a study of epigenetics. I won't get into that a whole lot. I'm still learning a lot about that, but it's interesting to me that the science backs that. Really, it comes down to us making a decision to make the changes we need to make to be healthy.
So I'm glad that you brought that up, that it comes down to us. So when we talked about like how self-care played into healthcare, that made me think, let's title this How Self-Care is Healthcare, because a lot of times we don't think
Mhm.
about prevention when we're so much in survival mode, like when we're in survival mode all the time.
Mhm.
Want to do a quick fix, we want to get on more medication. Like it's a lot of things that we may do to kind of go against what could be best for us. Can you talk about like some of the common things that you see people do instead of changing their lifestyle?
Yeah. So a lot of times people will make a lot of excuses, for not making those changes. People are busy. I get it. And then right now with COVID-19 and with people being at home and, they're closer to the fridge and they're dealing with the change, to their normal routine, their homeschooling, and there's a lot going on, and people are dealing with a lot of anxiety, stress, and the number one, I guess I wouldn't say excuse, but the number two reasons that I get for not making that change is time management. So people
Mm,
just don't have the time, and then they just kind of lack the motivation. Or a lot of times people really don't. When I ask someone, how do you define health? A lot of times I'll get, it's just basically the absence of disease. I don't have any chronic health conditions. I feel
mm,
fine. I eat healthy and I exercise. So for me to really encourage someone to take care of themselves, I have to have them look past that. I have to have them open their mind up and look at their health as multidimensional. So not just what you're feeding yourself on your plate, what are you feeding yourself off your plate? Your health also entails your career fulfillment, once again, your physical activity, your spiritual practices, you have to, your relationships, you have to incorporate all those things when you think about your health. Are you sleeping well? Are you hydrating well? Are you just internally, are you happy? But a lot of times, I think the problem is we're busy. We multitask when we're eating. So when we do that, we're not really mindful of what we're eating. We're eating fast and we're not digesting our food properly. That causes inflammation, indigestion, a lot of digestive issues. We no longer, take that seat at the dinner table. We're connected to our devices. We're sending an email and we're eating, at the same time. So we really just haven't really taken the time to prioritize ourselves. But your self-care is so important, and it does equal healthcare. I will just share a statistic. I think in 2018, U.S. healthcare spending went up by 4.6%. And it reached, the total cost of healthcare at that time was like $3.6 trillion. That's like $12,000 per person in healthcare costs. The U.S. spends a disproportionate amount of money in healthcare relative to its wealth. So we spend a lot of money on preventative healthcare conditions due to the lack of self-care. So it starts with you. So your self-care starts at home. It doesn't start in your doctor's office. I do encourage you to have a doctor. We need doctors, but I'll talk a little bit more about that later. But it really starts with you taking that control back and doing what you can do to prevent the hospitalizations, to prevent the overuse of the ER, to really cut the cost of healthcare so that it is affordable. We do a really good job in the United States with being reactive, dealing with chronic health conditions, dealing with trauma. But where we lack is that whole being proactive and focusing on prevention. So if I take care of me and I prioritize me, then I'm better for the whole. So I'm more effective at work. I'm more effective as a spouse. I'm more effective as a parent. I'm happier. I'm healthier. I'm whole. Well, that's not just about me. So what you do for you is affecting the person next to you. I always say there's people side to the other side of your purpose. What I do internally affects the person. So it starts with one person. So if you make that change, someone's watching you. And it's going to affect the next person. And if they make that change, that can maybe drive change in another person. We all are a unique piece to the puzzle, but we all contribute to the healthcare deficit. So we can all be a part of that change that we want to see to decrease healthcare costs and also just to be happier, healthy, and whole internally. If that answers your question.
Yeah, actually, you gave us a whole lot. And I think that that's good because we don't really see how some of those connect sometimes. Sometimes we think, just how you said, you're in good health if you don't have a health condition, right? And I think that's unrealistic for a lot of us. Well, basically, that is unrealistic. Sometimes your health is impacted, like you said, about high levels of stress and not digesting your food, eating and working like that. I'm guilty of that. That's probably like the top thing. Like, I'm always trying to send an email and like not, I have this thing right now where I'm like, okay, let me try to like chew my food for 30 seconds, instead of just like getting it going. But hearing you, it's just like, okay, I need to be more mindful about that. I need to actually, when I'm at the dinner table, not have multiple things there and use the dinner table for what it's for. And that's to like come together, have conversations, let's eat, let's talk. But I know that you are also passionate about conversation that needs to happen, especially at the dinner table. Right now, it's like get up and go. Especially with us being in a house with one another for so long, it's like I don't really like we've seen each other for the past like 15 hours. Like, so how can we encourage conversation still, especially when we're burnt out or maybe exhausted with like even interactions with our loved ones? What do you recommend?
Just really, reprioritizing what's priority, and making sure that you do, even if it's just 10 minutes a day that you sit down maybe with your family and get to communicate with your family about things that are important to you. Be able to, maybe if you were just to take your phone and sit in another room, or turn off the TV, and really all it takes is just being mindful, being there in those moments, like starting to prepare. What would encourage sitting down at the dinner table would be starting to prepare more meals at home. And when you do that, prepare it with love. Just the act of cooking for some people is de-stressing in itself. So what you might have to do is revise your grocery list, go grocery shopping. And then even if you just decide to set a small goal that, hey, I will have one meal a week at home with my family. And then involve your family in preparing that meal with you. You infuse it with love. And when you're putting those ingredients, in that food, you know what you're putting into it. So now I'll take it back to your health. You tend to take in less sodium, less sugar, less fat when you're preparing meals at home. And then to sit down and to be able to enjoy that meal with your family, that makes it more of a social engagement and you begin to connect. And that's good because then you have healthy dialogue along with a healthy meal. And then that love is being shared at that table. And believe it or not, that helps to decrease your internal stress levels. There have been studies that show that we walk around in chronic stress all day. Well, we walk around in fight or flight response. You've probably heard of that. That is the activation of your sympathetic nervous system. So your sympathetic nervous system it's good. It's supposed to go into effect when there's danger, or when there's trauma. But because of the way we are in today's society and our high exposure to a lot of stress, we're constantly activating that system. But when that happens, you have these surge of hormones that come out. One of those stress hormones being cortisol. Then you have this belly fat, this deep visceral fat that's deep in your belly. It surrounds your organ systems. Well, it's more sensitive to cortisol. And what cortisol does is it increases that belly fat, right? And then so that makes you resistant to weight loss. And then also with that, it increases aging and weight gain. So then it's just a trickle down effect from there. And it causes low grade inflammation. But chronic exposure to those stress hormones and low grade inflammation over time is once again what leads to the chronic health conditions that we see. So something as simple as preparing a meal at home, eating it at the dinner table, having a conversation and disconnecting from your devices can do you a lot, in terms of your overall self-care. But that's just one small thing that you can do, choose to do that. Yeah.
Wow. And to think that those options are really preventative measures. A lot of I'm blown away because I'm thinking sometimes self-care is associated with if I just took a moment to do some meditation and that was enough. But then I started realizing, as I was hearing you talk, sometimes when you work out a lot, but you still don't see that much change in your body. Do you think that that's also attached to, just activating those stress hormones?
Right. So your body can become resistant to even if you're eating, a healthy diet and you're exercising and you're doing all these things, but you're still really stressed. You really haven't dealt with the stress, with the root. Then sometimes your body becomes resistant and that weight doesn't come off like it should. Because once again, we talk about the hormones and how your body, your visceral fat, the deep fat in our gut is more sensitive to that and can make that fat in that area a little more resistant to the weight loss. So you really have to deal, like sometimes I'll ask people, what do you think? A lot of times people know what they need to do to take care of themselves. But the thing is, people don't act off of what they know. People act off of how they feel. So when you think about self-care, you have to really come from a place of empowerment and not self-sabotage. A lot of times people, you'll say, well, what's going good with your health right now? And okay, well, I could be doing this better. I'm not doing that. But tell me what you are doing. And you have to help people to shift their way of thinking so that they can talk to themselves more in a positive light, so that they're motivated and they have an empowered mindset. Because a lot of times I'm here to coach you from the sidelines. You know what you need to do. You have the ball. You're on the field. You have to run the ball. So I'm here to coach you. I can give you some strategy, right? I can throw some ideas your way, but it's going to take you to implement those changes.
Yeah.
So I have to get in touch with what drives a person. What's their why? What's their life's purpose? What motivates them? What empowers them? So self-care is so hard because a lot of times we're not in tune with our life's purpose, and we're not in tune with what empowers us. We're not in tune with what motivates us. We think about ourselves in a negative light. We lack the self-confidence as well, and the support that we need to drive those changes. So I'm trying to take you from information, as a nurse, as your dietitian might be giving you, as your doctors might be giving you, to transformation. That's what makes it so difficult. How do I get someone to really prioritize their health and really understand the why behind why they're wanting to do that? Yeah.
Wow. So you are also in school right now, and you're studying integrative nutrition, and
Mm-hmm.
that is kind of like, and you'll be doing like holistic health and wellness coaching, which I kind of heard you speak about that a little bit. So can you share like why integrative nutrition? Why do holistic health and wellness?
Because a part of me knew that there's always something more. Like, what could it really be that is allowing things in terms of health to continue to go the way that they're going? I wanted to see a change. Also, nurses and doctors were like, we're not given a whole lot of education on nutrition. So I wanted to learn more about too how our food is functional and informational. So what you take in communicates to your body at the cellular level. It tells your body what to do. So when you take in food, if your body doesn't recognize it as food, then it sets up an inflammatory process.
Mm,
Digestive issues also culprit for a lot of chronic health conditions. And I wanted to learn more about that because I myself, I've struggled with digestive issues for years. I've had every test known to man, from the endoscopy to the colonoscopy to,
mm-hmm.
they looked at my gallbladder and no answers. So I
Yeah.
knew that nutrition played a foundational part in our health, and I wanted to learn more about it. And then also, I wanted to have a more holistic, non-judgmental approach in terms of my coaching. So I knew that the Institute for Integrative Nutrition would help me to do that. So to help me to do what I'm already doing at my job, which I love, but also to be able to do it better, so more effectively, to have a larger knowledge base, and then implement that into what I'm doing, and to carry it out there into our community, and to share that knowledge with people, because I have family members with diabetes, I have family
Yeah.
members with heart disease, I have family members that are depressed or stressed. I myself have dealt with, some of those conditions. So that's what inspired me to learn more. So that's why I want to get that certification. So I'll have a certification where I'm able to, um, yeah, go ahead and share that with the world.
I think that that's good because a lot of times that answers the question of how people want to know like how did you get into what you got into? And honestly, I don't want to work with any. I wouldn't want to work with anybody whose work hasn't directly impacted their lives in any way. I don't want to work with an idealist. I don't want to work with someone who sees these roles as being something that is a money go getter type of ordeal. I want to work with people who are passionate about what they do, who have life experiences that have impacted them, who are putting in the work, like studying, getting the education, sharpening the skills, and practicing it. And I think that direction you're going is a great way to go, and I think that your work would be phenomenal, and life changing for people because you have something invested in it, and I think that makes the difference. And I'm glad that you also mentioned about how you went to a place where was like there has to be more. I've done everything that it's said to do right now to search my body, and I still don't have an answer. And I really want you to kind of talk a little bit more about how that made you feel, like to be in that place, because the people you help are there, but what, like, share with us how you kind of got out of that place and here to say, you know what, that this is what I'm gonna do about it.
This is what I'm going to do. I miss what you said.
Yeah, this is what I want to do. This is my response to no
Oh,
answers.
yeah. So like when I really decided that I've become passionate about this was my life's work. This is what I wanted to do. Um, well, before I became a health coach with Health Raise, which is now Share Care, I worked in the hospital. I worked at Missouri Baptist Medical Center as a med surg oncology nurse. And I just saw how sick people were. And, you know, I'm at the bedside and I had several patients. I see how, I mean, God bless our nurses. You know, they do a lot of hard work and they're needed. And I would have patients, and on top of that, those patients would have several doctors, you know, and then on top of that, you have family members too that you're dealing with. And I just felt like I didn't have, for me, I'm passionate about education and I'm passionate about building a working relationship with those that I'm talking to or rapport. You know, I just didn't have the time in the hospital to really share, you know, with that patient or to really have a discussion with that patient around how can we prevent you from even getting here. You know, I knew I needed to be in healthcare, but I wanted to be on the other side of the bell curve. I wanted to be more on the preventative, proactive side, and I wanted to prevent those people from coming into the hospital. So I was like, although I knew I was meant to be a nurse, that just wasn't where I was meant to be. So now I found a place where I'm passionate. You know, I really want to focus on prevention and wellness and what can we do to hopefully prevent you from getting to that point. And there's a lot that can be done. There's a motivational speaker by the name of Jim Rohn, and he says, "Take care of your body. It's the only place you have to live." And when you think about it, it's like, it's true. Take care of your body. It's the only place you have to live. And if I can add to that, take care of your mind too, because the research backs that your mindset. So what you think about yourself, your mental affects your physiology. And what you're thinking can either have a negative effect on your health outcomes or a positive effect on your health outcomes. And this affects you once again all the way down to the cellular level. And we know that sometimes the outcome of what we think about ourselves, what we believe about ourselves, and our confidence levels are reflective in our healthcare outcomes. But that's what drove me to where I'm at now. I just wanted to be on the other side of the bell curve.
I think that you are saying exactly what a lot of people are out here feeling right now. You know, this time has allowed us really to say, am I doing what I want to do? Am I living the way I want to live? Have I changed the things that I
Mm-hmm.
really need to change to have the lifestyle that I really, really want? And
Mm-hmm.
how can I create smart goals that are attainable? Like, how can I
Mm-hmm.
do that? So help us, give us some ways of how we can actually do this.
Start small, and we do use smart goals too. So when I'm coaching a client, you know, we're talking about those smart goals. So be very specific. Don't set vague goals. Make sure you have a vision. Visualize, like, okay, so I'll start off the conversation. I'll say, you know, where you are now, where you see yourself health wise now, where would you envision yourself in the next 6 months? Okay, so you need to have a vision. And sometimes, even though we may talk to ourselves in a certain way, our mind thinks in pictures. So if you have to create an image and put it somewhere where you can visualize it daily so that you can reflect on it to drive home that change, do that. I tell people, write your goals down. Put them somewhere where you can see them daily and reflect on them, because it's the mental muscle that you have to strengthen first. It starts in our mind. And then less is more. Like, I'll talk to people and they're like, well, I have to exercise 30 minutes, you know, 5 days a week. And then also I want to eat right, you know, and then, you know, I want to make sure that I'm moving about 2 to 5 inches. I want to lose 50 pounds. Single pointed focus. Focus on one small thing at a time. Okay. And then give it 21 or 30 days. You need to create a new habit. So write it down, reflect on it, allow yourself time to create the habit. And then once you create the habit, you're more likely to sustain it. So it does need to be realistic. I'm sorry. It does need to be time bound. You know, it does need to be attainable, measurable, and specific. So in terms of SMART goal. But I always just tell people start small. So like if they say they want to lose weight, I'll say, okay, think about weight loss as the byproduct of the changes that you're trying to make. Weight loss is the big picture, and that can be an overwhelming goal. But what are some things that you can do to lose weight? One thing is drinking more water. Sometimes we'll just start there. Okay, so let's drink more water. So I'll work on taking in, you know, 2 to 4 bottles of water a day is something that I'm not already doing. How does that help with weight loss? It aids in your digestion. It helps your body to get rid of toxins. It acts as a filler. It helps to transport nutrients to your body the way that they need to be transported to the cells so that they can function properly. So we talk about the why behind doing that. And then we talk about strategy. Well, how can I do it? You know, because if I let them set a vague goal, they won't follow through. So how can you bring yourself to a point of drinking more water? Well, I don't know. Well, I'll let them brainstorm a little, then I'll give suggestions. So for some people, it's setting a reminder on their phone or having, the water bottles at their desk. Maybe using a fun straw. When you drink out of a straw, you tend to take in more. And also, if it's something that's attractive to you or that stands out, you're more likely to grab it. And then also have some accountability. So maybe track your water intake or have someone, a family member or a friend, tell them what you're trying to do and see if they'll hold you accountable to that. And then I'm here to hold you accountable as well. So set the goal small, single point of focus, give yourself time, write it down, visualize it, and have some accountability. That's what I would say.
Thank you so much for all of the information that you shared today. And I'm hoping that the viewers can go back and kind of watch this episode again or share it out so that people can learn how self-care is healthcare. Kind of, I would love to say replacing hospitalization, but that is the hope. And
Yeah,
so
definitely.
I believe that this will be promoting positive change in the healthcare system for individuals. So, just before we kind of wrap it up, is there any advice or any last things that you want to share that you just want to get out before we go?
Well, definitely take care of yourself. It's not selfish, as we've discussed over and over again. When you take care of you take care of others, right? And then when you prioritize you, you're better for the whole. So you're more effective in all areas of your life. And I would say, when you think about your health, take it past your plate and take it past just the level of physical activity or just the mere absence of disease. It's bigger than that. So make sure that you are, you're fulfilled. You understand what your life's purpose is if you're able to do so in your career. Make sure that you're in healthy relationships, as healthy as they can possibly be. So take that into consideration. Even your spiritual practices play a role in your overall health and wellness. And it's okay to be selfish in terms of your health care, because you're really making a change, not just for you but for us all.
Thank you. And how can we learn more about you, or where can we find information if we'd like to connect with you?
Yeah, so I'm on Facebook, Tisha Henderson, Tisha Henderson. Also, my email, you can email me directly, Tisha, Tisha, aka 21 at gmail.com. And I also have an Instagram. I'm not as active on Instagram, but it's Tisha, Tisha, aka 21. So you can find me there. If you have questions for me, I'd be happy to answer. Or if I can support you in any way.
Okay, and just one last thing before we go. Tell us something that you know is true that almost nobody agrees with you on.
That we have the power within us to make the changes that we need to make to be our best selves. Like, we carry it internally. Everything you need to be successful in life, you already have it. Sometimes people don't agree with that, but it's all there. And we just have to find a creative way to bring it out.
Thank you so much for tuning in with us today. I think that it has been very good connecting with you today. I think that this conversation was needed. I think that many people need to really put themselves first and prioritize. I think that's a personal thing to do, and it is my hope that we do that to the best of our abilities. And thank you so much for your time.
Mm-hmm.
Thank you so much.
Thank
I
you so much, Christian. Thank you for having
You
me.
are welcome. I appreciate you. Hang tight for me. Thank you all so much for tuning in to another Ask Christian session. And just remember, as always, my final three C's is to connect with yourself authentically. and to commit to your own self-care, balancing your own life and taking care of your own business, and consistently do it at a pace that works for you. Now you can also learn more about My Secrets Purpose Conference at mysecretspurpose.com. Thank you for tuning in, and we'll see you next Thursday for another Ask Christian Shield session.